he went to a system other than the Cleveland Clinic, even though you've been number one for many years, because we heard you don't have empathy. Do you have empathy, Dr.
Mm,
Cosgrove? And
mm,
that really took him back. And he thought about it and he looked at our results and he determined, we have an opportunity here. What patients want most is to trust their healthcare provider and system. And to have trust, you have to have logic. You need to know what you're talking about. We do that really easily. That's intrinsic. We're pretty smart doctors. We'll tell you. We know it, right?
mm,
But you also have to have that
mm.
empathy. You have to care about me and you have to have authenticity, right? You have to be real with me. Don't tell me any lies. Don't shade me, give me the truth. And we found that although we had some degree of authenticity and we had plenty of logic, where we were failing was in the empathy. And so a number of different systems were developed in order to build empathy organizationally and to build that into the fabric of our culture. So it started really with communication training for everybody. It started also with renaming employees caregivers. How powerful is that? You're not just somebody who shows up
Mm.
to work and punches a card. Now you are somebody who gives care every single day. And so the cultural changes that Dr. Cosgrove started have, really been part of our fabric now for many, many years. And that's the culture that we lean into every single day.
Yeah, so that's fascinating. And for those people listening, it probably wouldn't be the first time you've heard me talk about the trust equation. But Charlie Green, who wrote The Trusted Advisor, said there are four variables that have to do with trustworthiness, which is a word that you mentioned, trust, as something you were seeking as a hospital. And those four variables are credibility, reliability, intimacy, and self-orientation, which is the inverse, right? You want the inverse. So, and as I think about the knowledge that you shared, well, that would really go toward credibility. I'm
Mhm.
sure the reliability was the follow through and all that. And then that whole right side of the equation, which is the intimacy and the self orientation. Well, if you're not completely authentic or you don't appear to have empathy, that could be low on self orientation on that score, and also low on intimacy, which is a lot connected to empathy and this idea of psychological safety. Can I trust you from the standpoint of, do you care about me? Do you make it a safe space for me? And and I guess, there's probably no better case study than in a hospital.
Mhm. Absolutely.
Yeah.
Yeah, when we look at our key drivers of likelihood to recommend, which is our true north in patient experience, that's how we're measured and how others talk about us, right? So when we look at that, what's most important to patients is communication, it's empathy and teamwork. Those are the most important things to our patients. That's what drives likelihood to recommend. And so when we wake up in the morning and we talk about what initiatives are most important among many on the HCAP survey, we're asking dozens of questions. So we assess lots of things from, was your transporter nice, to did you have a place to park your car, all the way through how did your doctor communicate with you? Did they listen to you? Did your nurse listen to you? Did they show concern for your special needs? That's what's most important. And that's what we lean into in terms of effort and initiatives when there's so much to drive.
So I just want to double tap on a few of the gems that you just shared so we don't roll past them for our audience. You shared a couple that number one is the doctor didn't just put a few people through the communication training, Dr. Cosgrove, he put everybody through it, right?
That's right.
Everybody had to get level set on what we're talking about. Two is changing the name of the titles of the jobs to caregiver. I mean, wow, that's going to make you think about your own role differently.
Oh, absolutely. It's inclusive, right? We're all caregivers at the Cleveland Clinic. And also with the training, with the training that we did, that was a hard sell. I mean, he burned a ton of political capital with that, I'm sure, because we put the most genius surgeons through that training.